So I will try to say what is the People That Deliver initiative, where we come from, where we're heading. If you have problems understanding my English, I'd be happy to continue in French. So don't hesitate to interrupt. The background, it's important to know where we come from. In September 2008, the initiative started inside a work stream of the Reproductive Health Supplies Coalition. This work stream published in December 2009 a white paper, and the major innovation inside the white paper was to suggest that the issue of professionalization of supply chain is a transversal issue shared by all programs and was not limited to reproductive health. So among other innovation, that's where we come from. The fact that human resource is mentioned is already quite significant because most of the money goes into commodities themselves. Two, the fact that the supply chain must be managed by professional managers, partly, either professional health cadres or professional logisticians, that it was cutting across health programs, and also not only the human factor, but that there was to be a systemic approach on human resource, which is not only training, but it's also recruiting, motivation, incentive, retentions, especially in the rural areas, and all those factors. In May 2010, it developed into a global initiative. In February 2011, it was rebranded as the People That Deliver, with a lot of discussion on the that or who, and you know English better than I do. In June 2011, we held a global conference at the WHQ headquarters in Geneva. And in November 2011, the first board was officially elected. The identity of the initiative has a vision, a world where national supply chain workforces are planned, financed, developed, and supported in a way that ensures equitable and sustainable access to the medicines and other commodities needed for optimal health outcomes. The mission is to build global and national capacity to implement evidence-based approaches to plan, finance, develop, support, and retain the national workforces needed for the effective, efficient, and sustainable management of health supply chain. And the overarching goal of the initiative is to improve health outcomes by developing sustainable excellence in the health workforce for managing supply chain. So this is the change in paradigm that we are looking for. The objectives of the initiative is first to improve the recognition among key international and national agencies that the performance is related to the performance of the health outcomes, and two, that it's a complex system that needs to be managed with significant technical and managerial capacity. Second, that there is the need for harmonization across agencies, such as the required competency framework, certification, pre-service programs, and so on. Three, that governments and national institutions demand technically qualified staff and provide those supply chain managers with appropriate career track, support, and incentives. And last, that cadres of qualified professional supply chain managers working at national and subnational levels. The benefit of the initiative are that those cadres that will be trained, qualified, will be working in public health institutions both at national, intermediate, and peripheral level. Two, there will be better supply chain policy making, decision making, and performance. And as a result, better availability of those dearly needed health commodities. Three, greater availability of human resource for clinical needs, because the nurses and doctors will be available for their core business instead of fixing things or managing logistics. 4, that there will be reduced dependence on external technical assistance with the empowerment of supply chain management. They will devise their own solution depending on the context of the country. And lastly, of course, and not least, a greater cost efficiency in health program to, we believe, a tremendous extent. The approach has a focus on sustainability and strengthening national systems and institutions, as compared to the targeted approach to health issues. 2, the idea is to involve a very broad array of key stakeholders from all levels, global, regional, national organization. It's an open initiative. 3, to promote harmonization of approaches across health programs and health organization at all levels. And also to develop assistance that acknowledge and accommodates the diversity of country contexts that exist and the diversity of roles among individual managing supplies. For example, I mentioned in the introduction that it deals both with professional health logisticians and the professionalization of health personnel with supply chain functions. The structure of the initiative has a board and a secretariat. I won't list all the organization inside the board, but you see that there is a diversity between university, donors, private sector, international organization and NGOs. The secretariat is currently hosted by the Bioforce Institute. There are 3 working groups, one working on technical issues, second one on advocacy and knowledge management, and the third focusing on research. And there is also the notion of focus countries. So the list is here. I'd like to not to list them all, but to mention Burkina Faso, Namibia, and other countries. I don't want to forget anyone. And even though it's a new and young initiative, there are already significant achievements. The first one was the global conference on the end of June 2011 that was attended by 170 representatives from 13 country delegations and 60 international organizations. This conference raised indeed awareness on the issues. There was the statement of commitment to action signed by all participating agencies, an agreement from countries and development partners to work jointly, priority interventions were identified, and specific contributions of members were documented. Action planning was initiated by countries, as will be shown later in this session tonight. Other achievements, to gather fact, literature review, healthcare supply chains in developing country, a situation analysis, global survey, 8 country surveys, a virtual forum, a dedicated website that you can visit, that you are warmly encouraged to visit, a training database for training opportunities called Laptop, hosted by the Reproductive Health Supply Coalition. We achieved coordination with all members of the initiative and developed advocacy material. Activity and priority interventions, I won't list them all, but it's at country level. You can skim through that, and we can get back to it in the questions. At the regional level, it's about connecting all the initiatives dealing with the subject to adapt the global resources, also mapping and increasing the database, and build the regional level professional networking and mentoring opportunities. And at the global level, there is work in progress for towards a model competency framework, or at least understanding between various frameworks, the facilitation of documentation and dissemination of the evidence base, to develop the advocacy materials, and to support an information clearinghouse. This is what the People That Deliver initiative, and I want to make clear that this picture taken during the conference at Geneva is not a picture of the people that deliver, it is a picture of the people who work in support of those people. Thank you for your attention.